That is a lot of information. What do we make of the models and this new information from the government? I'm joined now by Dr. Dennis Kendall. He's a retired physician and currently a health policy consultant in Saskatoon. Dr. Kendall, what are your first impressions?
Well, my first impressions were, as you said, there is a lot of information packed into the 45 slides that I reviewed from the Health Authority. It's very, very interesting information. And I guess my very first impression is, as a citizen, I'm really impressed with the preparations that have been made for the various scenarios. It gives me some comfort to know that that detailed planning has occurred.
When you look at the services expected and the hospital and equipment capacity that we have, would you say that our province is prepared for those scenarios?
Well, it has layers of preparation explained in the document. So I believe currently we have 98 intensive care unit beds, and there is options to go up to as high as 963 beds if that became necessary. That's an extraordinary expansion of capacity. It would take a great deal of effort to make sure those beds were properly staffed with the people with expertise needed to care for acutely ill patients. But obviously the planning is in the works, and so I think that's reassuring.
It's been about a month since our first case back on March 12th. That's when that was announced. Through all of this, now having the latest modeling numbers, what do you think your biggest concern is?
Well, frankly, one of my concerns is that people develop precaution fatigue. And sometimes if you begin to see a leveling off of the curve, as it's called, the rapid escalation of cases, there is an inclination to prematurely think we can go back to the way we had been interacting before. And until we actually receive clear direction from our Chief Medical Health Officer to do that, we really have to stick with the current precautionary activities we're engaging in.
Dr. Kendall, there's a lot of numbers. They can be really scary for people. Looking at everything, is there a silver lining or something positive that you can glean from today's report?
Well, I'll tell you the most single thing I feel really positive about is going back a little more than 2.5 years ago, I played a role in reviewing our healthcare system and recommending that we move to a single health authority. And the government of Saskatchewan accepted that recommendation. And I have to say, as I listened to the very highly coordinated presentation from the health authority today, I said to myself, if we had to do this planning with 12 separate autonomous health authorities, we would be in deep, deep trouble. So I'm grateful that we've had a couple of years of expertise developed within our single provincial health authority, and I think that's beginning to show real value.
Thanks so much for your time, Dr. Kendall.
You're welcome.
Dr. Dennis Kendall is a retired physician and a health policy consultant in Saskatoon.